Hello, my name is Sophia. Today I'm going to be doing an IV flush and I'm going to be assessing an IV site. So before I would do this, I would make sure to ask the patient two identifiers, so a first and last name and date of birth, and I would scan their bracelet and then check the MAR for the medications. And so first I want to assess the IV site to see if there's any redness, swelling, if there's edema, if the IV site looks like it's just bulging out and doesn't look right. I want to assess that to make sure. And then firstly, I want to do my first flush for the patient. So we're gonna do about half of the saline solution into the IV. And before I do this, I would get an alcohol wipe and I would swipe the end of the IV site for at least 15 seconds before I did that. So, and now I want to flush this to make sure that the IV site has patency. Right. And so it looks like that the IV site is running pretty well. So now I want to make sure I would check the MAR that to make sure the medication is correct. And I'm gonna draw it up with this blunt tip needle. So I would check the MAR to make sure we have the right amount, and I would also check the MAR to see how long over a certain period of time we would need to inject the medication. So say 2-3 minutes. And so now I'm gonna draw up my medication with the blunt tip needle. And then I want to make sure there's no bubbles or anything, which there are not. And so I would swoop this cap back up, and then I'm gonna put this in the sharps container. And again, I would make sure that I would swab the tip of the IV site with an alcohol swab, and I would make sure that I would be looking at a clock or a personal watch to time the rate at which I would give this medication over a certain period of time. And then I would make sure that I would put this in the sharps container as well because it's done. And now lastly, we're on to our other half of our second IV flush. So the same as I did with the medication, I would flush this over the same amount of time in the rate that I did for the medications. So say I did the medication over 2 minutes, I would do this same for the IV flush. And again, wanting to make sure that we clean the tip of the IV site with the alcohol swab and make sure that's clean between each different thing that we're giving to the patient.
I'm going to untape everything to make sure all the bubbles are out. Okay, so I'm going to check your lung sound. Can you breathe in for me? Take a deep breath.
And then we would dispose of this saline syringe into the sharps container. And then again, making sure before I go, checking the IV site one last time, making sure that the tape is secure. And we want to lock this now. And we are good.